This is Tip, a dog presenting to us today in suspected cable syndrome. Hasn't eaten for several days, has never been to the veterinarian before. Very, very strong positive for heartworms and severe heart and lung disease on x-rays. He's also got hemoglobinuria, which we're hoping he will show us here momentarily as he gets over the smell that he's intrigued about. There we go. Very typical finding in heartworm positive dogs that are to the point of cable syndrome. This is our patient prepped for surgery. As you can see, we go in on the right side with left lateral recumbency, and as you can see from the video here, his jugular vein is distended. Very, very typical of dogs with cable syndrome, and if you look closely, you can actually see some reverberations as the flow is coming backwards. Some very mild jugular pulses if you look. So we have dissected out the jugular vein, the right jugular vein, and as you can see here, we've got it isolated pretty well. We will be ligating the top half about right here, and then we'll be making our incision into the vein and feeding our catheter down towards the heart. Here is a snare that we're going to use. This is a homemade little snare made with a red rubber catheter and 3 pieces of suture material. The idea being is we go to the point of the worms and we twist, and as you can see, it's like a fork in spaghetti, just kind of intertwines the worms, and then we retract and pull them out. Okay, so we've made an incision into the jugular and we're retracting dorsal and ventral, and we're going to pass our catheter into the jugular vein with the suture material, and we're going to go down the jugular towards the heart. As you can see, we made a mark on our catheter here, which indicates about the level of the entrance into the right atria, and that is about the part where we're going to start to twist and turn. And we'll do this a few times, hoping to ensnare a few worms, and then we'll pull back. And we have worms.
You want the video still going?
Yeah. There's 1, and there's 2, and there's 3. 3 on the first pull. So far, as you can see, we have pulled out 10 worms, and we're now on past, I think, pull number 4 or 5. So we're pulling out, and we're going to see what's on this one. Whoa, we got the mother load on this one.
Wow.
As you can see, they just keep on coming. Not sure how many that is, but it's probably about 8 or 10 at least. Where are we at up to? That's 57, right? So we are at 57 worms, as you can see. With the pull that we just had has broken the record for most worms we've ever extracted. 57 plus this, we're probably easily at 65 at this point. So we have finished the procedure. To finish, when we're done removing the worms, we actually come back in and we ligate the jugular vein. This is a permanent ligation. 2 sutures up here. We also put a stitch down here just because we did have some backflow from the heart. This will be closed over in a routine fashion, and no further treatment or medical necessities for the area. As you come up here, you can see this is what we removed, and the grand total that we removed was 90 worms.
Tip, 18 hours post-surgery, much stronger. Hey Tip. Hey boy. So here is Tip's urine the day after. Much more normal.
So here's Tip. He is back to visit us 1 week post heartworm extraction. As you can see, he is very alert. Feeling quite good. Owners report a complete turnaround in his behavior, his attitude, everything. He's 100% back to normal, and as far as he knows, there was never an issue. Hey, big guy.